See if the recording has been started. Yes, probably. No, it yeah, has started now. Let me check again. Yes. Hello again. My name is Alexey Kalmykov. I'm professor of the Department of Internal and Occupational Diseases of Kharkiv National Medical University. Today, we are going to have our next lecture in myocardial infarction. Tell me, please, have you already studied this topic in your practical classes or not yet?
Yeah, doctor.
You have already?
Yeah.
Good. And what did you already have you already studied? What exactly? I mean, myocardial infarction or heart failure or what exact topics? Where are you now there? Am I online? Do you hear my question? I wondered what topics have you already studied at your practical classes? Hello? Am I online or not? Dear students, do you hear me? Okay, let me check by myself. Just few seconds.
Hello, doctor.
Okay.
Hello.
Hello. Hello. Could you inform me, please, what exact topics have you already studied at your practical classes? I wonder, in order to adjust the material more in more useful for you manner. What
I'm
topics? Mhm. What topics have you already studied? Do you hear my question? Hello?
Good morning, doctor. This lecture is for dentistry student also?
Yes, of course. It's in the course of internal medicine. It is this topic is
Okay,
adjusted
In the,
for
okay. In
yes.
the practical class, we studied about the pneumonia and about the bronchial asthma.
Okay.
So,
Okay. So you haven't studied myocardial infarction in the course of internal medicine, right?
yeah.
Good, good. I suppose this. I just was surprised when you told that you have already studied. Of course, you have studied this material at pathophysiology and pathomorphology and
So,
propedeutics. So in many departments, I mean in our subject, at our department. Good. So I hope that uh, oh, yeah, and don't forget, please, just a few seconds. I'll check if you have registered to the lecture, because um, probably they could check this. Just a few minutes. Just a moment. Oops. And one moment again. Uh-huh. So let me check. You haven't, right? I'll send the link to you now For instance, it's available in your invitation somewhere here at the very first registration and feedback form. Please don't forget to register yourself. I make a copy paste to your chat, to our chat with you. Do you see it now? Registration and feedback form, okay? Okay.
Okay.
Thanks. So don't forget to register yourself, and let's focus now on today's topic. Oh, so basically, as far as I know, you had already the very first lecture in internal medicine, right? In arterial hypertension or something like that. Yes or not?
سولف واجد يا أخي.
Did you have? Yeah, I see that you already had the lecture in arterial hypertension. It was 13th of February, right? People, are we in line with you? Okay. No, maybe not. Good. So maybe I'll deliver the lecture, and when you get any questions, I'll do my best to answer. Okay. Let me check if, yeah, you have started registration. That's good. And let's return to our today's topic. Our today's topic of the lecture is myocardial infarction. This presentation has been prepared by my colleague, and I love it so much that I'm going to use it in our lecture today with maybe some extra, some additional videos I have prepared for you as well. You can see that there are 5 of them. Finally, all the materials we'll discuss today will be available on the website under the name of either blog, right? Under the name of lecture in internal medicine myocardial infarction. Here is the link to our today's Microsoft Teams meetings or lecture. And you may also have this link. Just one moment. Let me see if you have. Update, preview, view. Let me see. It will remain here. Here it is. And let me see. Yeah, it's available here as well. By appropriate link, I'll send it to you now, probably. Just one moment. The 1st of March, presentations and other materials. Save, and this information you'll get now in your emails, in your timetable or calendar. I'll place all the links to this presentation and these YouTube videos I prepared for today's illustrations here on this publication, Lecture in Internal Medicine. The link to it again is available in your invitation presentations. And I'll repeat it in my vlog after I place this recording of this lecture in it. If you get any question during today's lecture, feel free to ask them by raising, or at least let me know about this fact by raising your hand. Or if anything is urgent, you may just start talking. Okay? I hope we agreed. Okay, so let's continue. Myocardial infarction is one of cardiovascular pathologies and one of critical clinical forms of coronary artery disease, or a group of diseases with affection of coronary artery. Sometimes in everyday communication, they name this condition as heart attack, while heart attack directly or literally is a symptom of different conditions. And only one of these conditions might be myocardial infarction. By definition, myocardial infarction is a necrosis. If you remember the course of pathologic anatomy, infarction is a form of necrosis caused by ischemization, by disturbance of blood circulation in some place, in some tissues, in some part of the human body. And as soon as necrosis is the cellular and tissue death, it's irreversible condition. So by definition again, the disease named myocardial infarction is a form of coronary artery disease characterized by irreversible death of heart muscle caused by ischemization, caused by disturbance of blood supply to it. Before myocardial infarction starts, there is a preliminary condition named acute coronary syndrome. We'll discuss this more thoroughly later. And preceding conditions before myocardial infarction might start or acute coronary syndrome may begin. There is a stenocardia, or the synonym of this condition is named angina pectoris, which is a reversible disturbance of blood supply to the myocardium. By reversibility, we understand that by some conditions, by some reasons, the balance between requirements of heart muscle, myocardium, in oxygen and oxygen supply, in other words, blood supply, is not proper. And this results in appropriate changes. The most often direct cause of myocardial infarction is obturation, obliteration, disturbance of patency of the vasculature of the coronary artery. There could be different reasons, and one of most often is maybe obliteration with atherosclerotic plaque. Other variant is thrombosis or embolization, other kinds of embolization of this vessel. In order to illustrate this condition, I have prepared this animation for you. I hope you see it. Do you see the presentation? Do you see the screen now? Dear students, do you see the screen?
Yes.
Oh, great. Thank you. I'll comment. For instance, do you see the direct comments from the video? Should I comment for you? You may see, let me make a pause. You may see that in order to supply enough quantity of oxygen, and not only even only oxygen, but also nutrients to the cardiac muscle or myocardium, there should be enough patency of the vessels. And if there are problems with this, you may see on this slide, on this video, there is an accumulation of what atherosclerotic plaques here, right? And disturbance of the bloodstream. It's a chronic condition. It lasts for years to form such a disturbance. There could be other variants when there is sudden obliteration, sudden embolization, but in this case, it's most typically atherosclerotic plague. And you may see that locally, focally in this certain location, there is a rupture of vascular wall, of endothelial wall, and formation of bleeding. Actually, it's bleeding. It's entrance and of tissues, of formations, cellular formations around the endothelium into the inner parts of the vessel with the further formation of thrombus. You may see it's growing more and more and more and obstructing the bloodstream, obstructing the vessel. Since this time, due to acute lack of oxygen, due to acute disturbance of blood supply and ischemization of myocardium, uh, these people or these patients feels sharp pain, constrictive one, in appropriate location we'll discuss slightly later. And myocardium starts to suffer from this disturbance. At the very beginning, it is named acute coronary syndrome. It's reversible because myocardium is still alive, but out of oxygen, out of blood supply. And as soon as it is damaged, heart starts to contract improperly, not fully. The focus of no immovable parts of the myocardium appears, and this decreases the output, cardiac output. How does it manifest? Oh, maybe about manifestation, about clinical picture we'll discuss slightly later. Let's return to the presentation again. What are the types of myocardial infarction? Formally, they could be distinguished the following variants. Type 1 myocardial infarction. It develops spontaneously due to ischemization due to a primary coronary event, most often as erosion of atherosclerotic plaque or rupture or fissuring or dissection and so on, and embolization of the vessel, coronary vessel, or one of its branches. This is most often variant. There could be other type of myocardial infarction, which is secondary to ischemization due to either increased oxygen demand or decreased supply. When does it develop? When there is exceptional physical effort in sportsmen, in those who do not possess professional sports, but by some reason starts to have a significant, abnormally significant physical effort. And this may result in such a disbalance between blood supply and demands in this blood, in the oxygen. Type 3 of myocardial infarction develops suddenly and unexpectedly as a form of cardiac death with symptoms of suggestive of myocardial ischemia. It's a rare but possible variant. Type 4 of myocardial infarction may develop in association with percutaneous coronary intervention or stent thrombosis. And it's like a iatrogenic myocardial infarction It's also relatively rare, while it's possible, and we should also take this into account. Type 5 of myocardial infarction is associated with cardiac surgery with possible, again, maybe thrombosis, maybe direct affection of myocardium. It depends, of course. The myocardial injury has different etiological factors. Some of them are acute, some of them are chronic, but regardless of the cause, regardless of the etiology, the result is almost the same, similar, or even the same. It's necrosis, ischemic necrosis. What's about clinical manifestation? Let me show the clinical example of this condition. Just one moment. On this example, we'll observe that you may see that this man has been playing. Let me try to. Oh, unfortunately, it has a low quality, but I'll comment. So this man, you may see that it probably has um, some kind of obesity, or at least inclination to obesity, and he is probably not a professional player, not a professional sportsman, while he was engaged in the soccer, and he is um, playing it with pleasure, but at the physical effort, he feels sharp pain in the region. It's usually the heart region, with possible irradiation to left hand, left side of neck, or even sometimes left parts of abdomen, or some other variants. You may see that he feels so bad, and this pain is constrictive. He has to stop. He has to stop, and at this rest period, the rest part, he feels some relief, not full recovery, but some relief in pain. You may see that he tries to make some steps to continue playing, but as soon as there is a problem in oxygen supply to myocardium, and myocardium starts to suffer from this lack of oxygen, it myocardium, it cannot possess proper cardiac output, and this is a painful condition. Sometimes on this background, there is even cardiac arrhythmias may begin. And here is the how it looks like inside the vessel. You may see that here is the right side on the slide, plaque, atherosclerotic plaque, one, and maybe some more you may see later. And here is the focus of of this problem, right? You may see that this man tried to continue playing, while this leads to even more advanced damage of the vascular wall. You may see that there is like a scratching of the surface, inner surface of the vessel, with uh, you may see one more. I'll repeat this episode. You may see that some superficial layer of endothelium has been scratched off, and no, in this case, it's a mistake, of course. Not erythrocytes, but thrombocytes accumulate on this surface to cover it, to um, eliminate direct influence of the components of vascular wall and direct contact with blood. You may see that this man continues to play while he feels these attacks of pain again and again. You may see how hurtful it is for him. And if he continues to do this, and this balance between demands in oxygen and oxygen supply remains to be improper, what happens inside the myocardium? Look here now. Here are the heart, the myocardial cells around the vessels. You see how they become more and more dark because of lack of oxygen. You may see that impulsation continues, that it's painful. Stop playing football of this soccer. He feels pain. You see, yeah, it's a very characteristic gesture. It might be even more characteristic. I hope you see what I show. If he uh, would put his hand and even contract it. So because it's spastic pain, you may see he suffers. He's already has he already has this heart attack, and in few minutes, this condition might become worse and worse. You may see the frequency of contractions, heart beating is increasing. You may see, oh, here is this gesture is extremely typical for such conditions, such a contraction pain. These people put their hands on in the ear of either heart or left shoulder or something like that, and they try to pause their physical activity because this improve their condition subjectively, while it doesn't help, unfortunately, in this case. And he's falling down. Why there is falling down? Because the pain is so sharp, so acute, that even cardiogenic shock may develop, and reflectory, as a adaptively, uh, brain regulates the position of the body so that it should be in lying position. It's historically on the stages of evolution was these defensive reflex was elaborated, and he falls down. Rather often, this is accompanied by decrease of blood pressure, such a collaptic condition, and this lying down improves the blood supply to brain, because it's very important to conduct blood supply to brain than to other regions of the body. While, as you can see, heart continues to be suffering, and here is the focus of myocardial infarction, of this necrosis, ischemic necrosis. The man is still conscious while he feels so sharp pain that you may see how contractive his pupils are. His pupils. Of course, in this case, emergency should be called to help these men, these people, these patients. On the background of this condition, there could be even episodes of disturbance or some limitations in breathing, uh, breathlessness, or dyspnea. Heart and the organism itself tries to compensate this condition, tries to um, secrete hormones and hormone-like substances which dissolve, which decrease the clotting in blood, while this might not help too much. Sometimes it helps, sometimes not. You may see that this focus of necrosis is continuing to grow. Yeah, call an ambulance. Some person tries to help this patient and ask to call an ambulance, of course. And you may see that on this animation that blood supply is worsening more and more. In some cells, you may see now, will gradually undergo apoptosis, so undergo cellular death and even disappear. This lasts for a few hours. So in few hours, a significant, clinically significant parts of mm, these megakaryocytes will die, and the only way to survive will be improvement of blood supply and helping to survive at least the rest of myocardiocytes. And you may see that vessel is almost blocked here. Cell, you see, cell doesn't get neither oxygen nor nutrients and starts to die. If in time and properly the medical aid is applied, there is a chance to restore the bloodstream and to save at least the rest of myocardiac cells. You may see the breathlessness, you see the cyanotic discoloration in the nasolabial triangle, in distal parts of the fingers. Here is the illustration of the blood stream in capillary region. In this condition, they should get oxygenation. This improves the condition significantly. And very soon this person will get proper medical aid, and I'll show you what happens then. Okay. Okay. So if in brief, some of blood cells start to die, and this is directly reflecting on the electrocardiography. So you may detect this, not you maybe as dentist, but emergency personnel and cardiologists or general practitioners, and start to use this anticoagulant therapy. Starting from this time, these medications are applied, and if this help would be conducted in 1 or 2 hours, the prognosis for such patients, average prognosis, of course, some mean one, is relatively good, because this medication, as you can see, dissolves the thrombus, or improve the bloodstream, other how, and this leads to restoration of bloodstream, of normalization of oxygen supply and nutrient supply, and with relief and even full recovery. In other words, if the myocardial infarction is recognized in time and the proper treatment is applied, the prognosis for such patients nowadays is good. So they will survive and they will improve and everything will be okay. In order to understand what we can do, how does this disease develop, let's focus now again on signs and symptoms. So first of all, again, just one moment. First of all, again, there is a severe substernal chest pain, which lasts continuously for 3 to 5 minutes. Sometimes it radiates to the arm, into shoulders, into left side of neck, left side of abdomen. And what is might be useful for you, sometimes it irradiates into jaws, especially left sides of them. Of course, as soon as these people suffer from improper circulation, decrease of cardiac output, etc., they feel weakness, dizziness, lightheadedness, and so on. They might have symptoms of nausea and even vomiting. If you can conduct the blood pressure evaluation, you may detect hypotension. Even if you don't have this tonometer with you, and even palpation of the pulse or detection of the pulse helps to reveal this decrease of blood pressure. The skin might get pale or ashen. Sometimes it could be cyanotic, right? Cyanotic, especially in distal parts of fingers or toes and um, nasolabial region, in the region of lips. And you may detect this as a dentist. Then there is typically cooled and clammy skin, tachycardia over 100 beats per minute, so-called palpitation, and of course chest pain. Oh, here is the pictograms. Here are the pictograms of changes related to myocardial infarction. So there is uh, okay, maybe later we'll discuss it more thoroughly. What are the oral manifestations? In people with chronic coronary artery disease, due to repetitious periodical problems with blood supply all over the organism, and especially and more specifically in orofacial region, typically they develop xerostomia, taste changes, stomatitis, secondary inflammatory changes, gingival hyperplasia, and they could be also atrophic changes on the mucous membrane of oral cavity, etc. You may see these illustrations even more. And probably we'll make a short break now and continue with risk factors, prevention, treatment, and other approaches after this short break. If you have any specific questions, feel free to ask me now. And let me see whether you have all registered for the lecture. Not all, dear students. There are 7 students present in the Microsoft Teams lecture, but only 4 of you have registered. Please don't forget.
Doctor, how we can register it?
Okay, just a few seconds. You may see in your chat, I'll repeat this link for you now. Just follow the link you may see on the screen now and register here. Very simply, just a short registration form, okay? Have you found this link? Hello?
Yes, doctor.
Yeah, okay, thank you. Okay, just a few minutes for break, maybe 10 minutes for break. For instance, during this break period, break time, I'd like to invite you to one of our charity initiative, and it's available on my personal websites and my Facebook account. I kindly invite English-speaking medics of any specialty to our team to find and prepare applications for grants for different needs. It may start from some charity projects or social projects, or maybe support of your research, your student research, or maybe you're studying in Ukraine or abroad. My aim is to conduct the maybe to create the fundraising initiative, fundraising department for my social project named the Medical Cluster. Let me show maybe in brief. Just one moment. I'll open the presentation. Hopefully you see now. Do you see? Oh, maybe not. Just one moment. Just one moment. I'll stop the sharing. Probably you may see now. Oh, maybe I'll just one moment. Pin and share. I'll continue sharing now. Just a few seconds. Here it is. So as you can see, is it clear? Yeah. Oh, maybe not, right? It's mirrored. By some why. Let me see. Okay, let me try to. Okay, I'll do it in other manner. Some strange keys. Good. Here it is. I'll share again. Maybe it's better now. Yeah, it's better. So, in brief, the initiative is named Medical Cluster without some private name or so. And we are aiming now on the collaboration between different people and especially establishments or some organizations in field of medicine. I started from joining entering medical businesses into this cluster, like private hospitals or private laboratories or private diagnostic centers or private rehabilitation centers or manufacturers of medications or medical supplies or medical equipment and so on. Then as soon as some of our researchers and our medical practice projects were not effective enough in private spheres, we also involved municipal, departmental, and governmental organizations into our community, into our project. And as soon as we are, at the moment at least, out of foundations, out of funds, and there are 5 types of these resources: finances or material resources or technologies or information or staff. We are collaborating widely with non-profit humanitarian organizations like non-governmental, like charity foundations, volunteer groups, etc. And of course, as I am a professor of several institutions, universities, visiting professor, right? I'm not in the staff, but I'm engaged in the process of both education and science. So we collaborate with universities and medical faculties of universities as well in different relations. And finally, we involve into our projects other initiatives in field of legal support of information technologies with artificial intelligence or decision support systems and so on, marketing and PR and so on. And as you can see, funding as well, or fundraising. And we get the support from local communities, from majors, from on the levels of regional or city or village even, and cooperate, make partnership with abroad, foreign, all over the world, foundations or medical mm, organizations, academic structures, communities, etc. What exactly do we do? If you follow this link, you'll get the information. It's a bilingual document. The concept of medical cluster. It's in Ukrainian and in English. You may see that we have here the main uh, aim to support the health of population, in particular refugees nowadays in Ukraine, but all over the world as well, improving the medical care quality. And we have five tasks inside as decomposition of this aim. First is increase the efficiency and coordination. We get the grants, we get the support, and distribute it reasonably, effectively among private, other non-private organizations related to medicine, volunteer groups, academic institutions, and other relevant organizations. We provide local conditions to conduct proper medical care, including dental one or general medical, attract international aid to all these, and improve the quality of medical care. These are four step-by-step tasks we perform, of course, basing on evidence-based medicine and proper or it's good clinical practice. Yeah, proper, good, good. It's better to translate. Good clinical practice, GCP. Let me add here. GCP. And improving logistics and financing, it's not our aim. We have volunteers in these fields. Our aim as medics, as medical students or already practitioners, to conduct our work properly, efficiently, with maximum result for our patients and for ourselves and as improvements of our professional level. And what is more related to further maybe prospects is develop of further projects, branding of Ukraine region and settlement where this medical cluster is located. We have now in the Transcarpathian region, we are starting today one other in the Kharkiv region, and later we'll continue all over the Ukraine and abroad as well, in your countries as well. If you are interested, you might be our early adopters and early ambassadors and members. And I include here, I'm the founder of this medical cluster of this initiative, the inbound and outbound international domestic medical tourism, scientific medical research, clinical research of pharmaceuticals and medical devices and equipment, professional medical ecosystem as a medical valley. It's just a preliminary name of this project, further project. We haven't started it yet. Then improvement and introduction of highly technological health tech, med tech, dent tech projects into this ecosystem. So in brief, this is the main aspects of the concept of medical cluster. I kindly invite you to join. Well, you may see below in these documents what global sustainable development goals do we possess. The main one is the third, it's improvement of healthy lifestyle and well-being of people, but we have several more additional secondary, like sustainable management of water resources, sanitation. So they are not directly related to the medicine, but support it. So if you have any ideas about how you may share this initiative. I kindly invite you to start from just making fundraising for your projects. I'll do my best to teach you, to share the resources with you. My motivation is to uh, to you see, I name this my project of the life, and I'd like to remain anything after I go. And I really sure and I trust that I succeed with this, and this project will grow even when I will not be inside it. And it will help to uh, reboot, to improve the healthcare system, not only in Ukraine, but also in other countries and all over the world as well. And probably at that time, we'll already occupy or colonize maybe Mars, maybe some other planets. And uh, this will help significantly. If you have any ideas, so our break time is coming to the end, these 10 minutes of it. If you have any ideas, I would, uh, it would be pleasure for me to hear from you. Here is the concept, my personal, my own concept. It's also bilingual in English and in Ukrainian. So I try to summarize, to make it possible to how it is named, synergic improvements between science and education, health practice or medical practice, health development, business development, forming the ecosystem for all this. And on the overlaps of medical science and education and health development, there is what? Evidence-based medical practice. On the overlap of science and business, it's profitability, scientifically, ethically, and on overlap of medical practice and business development, it's complex, reliability, wittingly, practice with good supply. And I also have the strategic plan for the next approximately 20 years. You may see these two projects which we have already started. It's development of medical businesses, and one other is health mentor for um, people, like forming an ecosystem for patients to not only uh, improve the condition or even recover from some certain pathologies, but also to build, develop their health holistically. And the other projects are related to education. I already have started the education cluster, medical education, more specifically, medical education. Medical Plaza, like medical online aggregator and marketplace. MedRate, it's a medical rating agency, media, publishing house, co-working, it's offline, network of offline medical offices where you, as further future practitioners, may continue your work. It's tactical medicine development, medical HR, PR agency, creative and video production, photo video production agency, marketing agency, touristic operator, IT company, and then again returning to medical practice. A network of primary healthcare medical offices and specialized healthcare, again, medical centers and diagnostic centers, and so on, rehabilitation, mobilized healthcare groups, and so on, telemedicine initiative, and so on, up to even insurance and investment and social medical projects, while we conduct these projects even now. So let's return to our topic. Let me check before it if you have registered for the lecture. One, two. Let me see how many. Oh, yeah, 7. All of you have been registered. Good. So, what's this? One moment. I turn it off now. Good. Okay. And let's return to the lecture. Okay. And again. Good people. Oh, there are 8 of you. Please, someone has joined us these minutes. Don't forget to register yourself, filling the registration form. The link to this registration form I have sent into our chat in Microsoft Teams, and the same link is available also in your invitation to our today's lecture. So we have discussed with you the definition, the origin, the mechanisms of development of myocardial infarction, main clinical symptoms, and let's and even discuss the oral manifestation, right, of myocardial infarction, not specifically but possibly, by which you may suppose that something is wrong with this person and conduct the medical aid accordingly. Next, the risk factors for myocardial infarction or of myocardial infarction include modifiable and modifiable aspects. Modifiable. Smoking. Smoking is related to significantly increased risk of atherosclerosis, of direct damage of endothelial layer of vessels for one hand and myocardium from other. And the part of this smoking is associated with systemic side effects, or not side, but adverse effects on the human body in terms of respiration disturbances, respiratory diseases, predisposition to carcinomatosis, I mean cancer, or pardon, oncological pathology, etc. Then, diabetes mellitus. You will study this disease later next year, but I am definitely sure that you already have some basic understanding what is diabetes mellitus. What's the relation between diabetes and myocardial infarction? For one hand, diabetes mellitus, especially type 2, is associated with mm, hypercholesterolemia, and this is a main factor leading to atherosclerosis, angina pectoris, acute coronary syndrome, and myocardial infarction, finally. For other hand, second reason, in conditions of continuous, prolonged increase of concentration of glucose in blood, hyperglycemia, and due to non-enzymatic damage, just chemical reaction between glucose and structures or substances of inner layer of vessels, endothelium, with formation, it's named glycemization, right? This leads to disturbance of the structure of endothelium, endothelial dysfunction, and the rest of changes typical for atherosclerosis, clotting, and so on. And in diabetes mellitus, there are multiple other reasons for as a third, fourth, and other aspects, like disturbance of hormonal condition, balance, hormonal imbalance, inclination to obesity, and therefore this also leads to increased risk of coronary artery disease and finally myocardial infarction, etc. Then hypertension. Hypertension or increased blood pressure inside the vessels leads to mechanical, physical damage of vessels for one hand, and for other, increased demands, increased requirements of myocardium in blood supply, in oxygen supply, in nutrient supply, and so on, in order to contract and conduct proper cardiac output in conditions of increased um, resistance, right? Hyperlipidemia. Oh, I have already mentioned this as a risk factor for coronary, for atherosclerosis and coronary artery disease, etc. Obesity I have already mentioned too, because obesity, hyperlipidemia, hypertension, and diabetes mellitus type 2 diabetes mellitus, there are four components of so-called metabolic syndrome. And there is even an approach and understanding of this matter as a common, as a um, general disease, uh, and in which coronary artery disease and diabetes and so on are just the manifestations of it. Then the last in this list, physical inactivity as a modifiable risk factor for myocardial infarction, is related to the fact that trained trained myocardium is capable for higher loads, for better function, for better cardiac output. If the cardiac muscle and generally body is trained enough physically, it's much more easy for it mm, to survive and even not to develop the myocardial infarction at all because of better condition, better blood supply, better condition of the vessels, better capabilities of myocardium. And even if this happens by some reason, if you remember, we had different variants, different types of myocardial infarction. Even in this condition of already developed myocardial infarctions, those people which are physically trained, they survive with higher probability. They recover with higher speed and again probability. Next, non-modifiable age. We cannot directly influence, change our age, and with age, with just natural changes in hormonal proportion, in condition of our cells all over the body, of course, the probability of myocardial infarction is growing. But again, if we possess proper multiple compensate multiple risk factors, even age would not be so significantly important. Gender, in the majority of cases, maybe up to 60 or 65 years old, more inclined to myocardial infarction are, of course, men. And women start to also get into high risk after this period when there is the protective effect of estrogens is diminished, and this might lead to such a problems. Um, then the family history of heart attack. We cannot change our genetic predisposition, and just the fact that in someone's family they've already deaths especially, or just episodes of myocardial infarctions. This means that they have some kind of inclination to this condition, and therefore their children and their relatives might be too. The principles of prevention is identifying at-risk patients, reduce the anxiety regarding this, in case if anything develops. Then, from point of view of dental care, ensure the profound local anesthesia. Use local anesthetic agents containing a vasoconstrictor congruent with the patient's functional capacity. And there are some ideas about how to process the dental care, some aspects of dental care properly. It is stated that ideal time to schedule the dental treatment is short morning appointments for stress and anxiety reduction, for one hand. For other, the delay routine dental treatment for 6 weeks if patient has had a revascularization procedure, not to provoke some problems related to the risk of myocardial infarction. For example, the coronary artery bypass graft or stent placement, if has been performed, the dental care should be delayed. In order to illustrate what kind of medical aids might be possessed in patients with signs of myocardial infarction, I try to show you the following video. Here are the actors, of course. Here is the patient sitting in the chair with the symptoms. He just represents orally the symptoms of these problems with the discomfort in the left side of chest. He shows where it is located. Doctor wonders, detailizes the complaints, um, asks when did it happen, what exactly did the patient use in this relation. He asks for all the steps in the process of diagnosis of this condition, both passport data and complaints and anamnesis and family history and so on, and asks the assistant to bring the nitroglycerol, right, to put under the tongue and waits for some time. The time is about 5 minutes. Simultaneously, he evaluates the pulse. If he has, he might also measure the blood pressure and in general asks patient to have a rest and relax. In few minutes, in just few seconds, there should be an improvement. If there is no improvement, you may repeat these approaches 2 more times. So we give the nitroglycerol under the tongue, wait for 5 minutes. If pain has been disappeared, we succeeded, and this is probably not myocardial infarction. If it didn't, you may give again one more under the tongue, again wait for 5 minutes. If not, the third time and call emergency, probably if pain doesn't disappear under the taking the nitroglycerol. This might be myocardial infarction, and probably dentist is not a proper doctor who has to care about this patient. So emergency will take him to the hospital. Here is the illustration of what is the radical treatment for such a case when there is a problem with blood bypass through the coronary arteries. It's angioplasty procedures as a variance. It takes half an hour to 3 hours. The heart is monitored simultaneously, and intravenous sedative is applied. You may see, so the needle is put into the brachial vein and guided to the finally to the heart. And you may see that under the control of visualization techniques, there is restoration of the vessel in the place where it has been blocked. There could be different approaches to this restoration. It could be, you may see now, just a few seconds. Yeah, here, the probe is installed here up to this place of this problem. And there could be an attempt to dilate the vessel applied. You may see one and again and again. Of course, during all this procedure, they monitor the bloodstream, they monitor the condition of the heart beating, heart activity, and brain and everything, and then see if this condition helps, it's okay. If not, a stent may be applied. It's constant, uh, how it is named, implant. You may see now. It's similar, but slightly different. It's also enlargement of this inner part of vessel, but stent is remaining inside the vessel. In this condition, in this case, it possesses the patency of the vessel, and bloodstream is improved, and this significantly prevents the further possible episodes of both heart attack in form of angina pectoris or anything, or myocardial infarction especially. One more illustration I have prepared in this relation, and the last one for today is the following one. He, oh, maybe it's partly. I like this illustration because it highlights the location and the problem which happens in case of uh, disturbance of the bloodstream across the coronary arteries. You may see how it is. This plaque is located and growing on the vascular wall, and then clotting starts, and embolization of the vessel. Everything we have discussed with you, with further formation of the focus of necrosis in condition of ischemization. It's ischemic necrosis. And angioplastic procedure improves this situation significantly by applying the stent inside the vessel. You may see now. Again, it's other approach from the femoral vessel, going up, returning to through the vessels to the coronary artery, and finally, for instance, I now I remind that I told that that we use vein, but we use arteries, of course, to go there, to insert the probe. And finally, it reaches the location where there is a problem with vessel, with deflated balloon, then inflate it, dilate the vessel in the focus of this obliteration. And finally, then, if needed, apply. So apply the stent. Here it is, and remain it there like this. And later, after the period of rehabilitation, patients may continue to, no, after rehabilitation, of course, they may continue to just do everything he did before. To live and with good quality, health-related quality of life, etc. What, again, let's focus on what you should do in case if you suppose that attack of so-called heart attack or episode of myocardial infarction developed in your patient. First of all, prior to dental treatment, you should ask the patient about possible angina pectoris, stenocardia, or exercise intolerance previously, to prevent the development of infarction at all. Then the analgesia should be adequate to minimize the pain, discomfort, anxiety, and so on. Just one moment. The dental management should be the following, some main aspects. Avoid deep sedation techniques in outpatients. Monitor pulse, respiration, blood pressure before, during, and after dental procedures. Third, maintain verbal contact with the patient during the dental techniques. Fourth, have the patient eat a normal breakfast before dental treatment. And the final one, patients should be seated comfortably, semi-supine in the dental chair in order to make it possible for you to conduct proper medical aid. What again should be highlighted for your further dental practice? The signs of recovery in this condition, the myocardial infarction, is the fact that pain is sibling, vital signs returning to baseline values, vice versa. The signs of deterioration, pain persists, vital signs unstable, altered mentation of or even loss of consciousness happen. Then patient denial may minimize symptoms, and elderly and diabetic patients have a higher incidence of silent, with no clinical manifestation, myocardial infarction characterized by vague symptoms of shortness of breath, epigastric distress, hypotension, altered mental state. So you may not even guess that this is myocardial infarction, but you should be aware, and in order to be aware, you should ask about all the spectrum of health condition primarily before even conducting your dental medical aid. Then there should be more than 60 days elapse after myocardial infarction before elective non-cardiac procedures such as elective dental care. And finally, recent myocardial infarction, defined as having occurred within six months of non-cardiac surgery, is an independent risk factor for perioperative stroke. Again, in order to memorize what might be useful for you to keep at your workplace, here is the dental clinical setup for cardiac patients. Of course, probably maybe emergency drug kit, blood pressure monitor, of course, electrocardiogram, oxygen cylinder, hemostatic agents, and for other reasons, chlorhexidine, mouth rinse, or similar antibiotics, etc. If in brief, this is all I supposed to discuss with you today regarding our today's topic of myocardial infarction. Let me see if, yeah, you are present. Thank you, all of you. Good. Dear students, tell me please, what questions do you have at the moment? Maybe I can help you in any relation in our today's topic, in other topics of internal medicine, maybe in some aspects of your scientific research, or what I have proposed you on the break with possible collaboration in field of social, charity, practical, or business projects, and so on. I see that there were no questions at the time of registration, but what's about now?
Everything is clear, doctor.
Mm-hmm. Again, thank you. If any more comments will be, I'm waiting for you. Anyway, Anyway, I'm ready to receive your comments. Anyway, I like to remind you that the links to all materials will be available through this link, right? On my what blog. I will add all these illustrations and uh, presentation, and in even our today's recording of the lecture. I will upload it to YouTube channel and add this link here. So just follow the link available in your invitation. Okay, maybe I will rename it. Probably it's not presentations but useful materials. Use so thank you for coming. If you have any questions, do not hesitate to ask. If not, keep healthy. See you later.
Have a good day, doctor.
Same for you. Thanks. Okay, so I'll stop the recording and upload it now.